This year at ASH 2024, we have presented an abstract called Overall Survival with Momelotinib versus Best Available Therapy in Patients with Ruxolitinib-Experienced Myelofibrosis, a matching-adjusted indirect comparison. It is very well known that ruxolitinib is the main frontline therapy for intermediate and high-risk patients with myelofibrosis. But, however, most patients will eventually discontinue ruxolitinib, and these patients have generally a very poor prognosis. So there is a significant need for a more effective and safe treatment after ruxolitinib discontinuation. And this newer treatment should be able to improve long-term outcomes that include not only spleen and symptom responses, but also the improvement of the overall survival. However, in our real-world practice, the timing of ruxolitinib discontinuation, but also the selection of the best second-line therapy may be very challenging. And it is important to collect data that may guide this difficult treatment decision. Momelotinib is a JAK1 and JAK2 inhibitor like ruxolitinib, but it is also an ACVR1 inhibitor that is approved for the patient with intermediate to high-risk myelofibrosis with splenomegaly, symptoms, and anemia. Unlike ruxolitinib and fedratinib, which are associated with a significant drug-related anemia, momelotinib has shown anemia benefits and also symptom and spleen responses across the 3 phase 3 trials, the Simplify-1, the Simplify-2, and the Momentum trial. In this particular study of ours, we compared the overall survival in patients with ruxolitinib-experienced myelofibrosis from the momelotinib phase 3 trials and the overall survival of the patients who received best available therapy after ruxolitinib discontinuation. And this patient derived from the RUX-MF retrospective real-world study. To this aim, we created 2 models in order to adjust for different characteristics of the patient populations of the different studies. And also, we have performed a specific analysis concerning the patients with hemoglobin below 10 grams per deciliter. In all of our analysis, we have consistently observed that momelotinib provides a greater overall survival benefit compared to BAT in patients with myelofibrosis previously treated with ruxolitinib. I believe that these findings really support the use of momelotinib as a standard of care in the patient with anemia who failed ruxolitinib therapy.